Hello everyone, and welcome back to my channel. Welcome to Prescription Nurse, your daily dose to living well. I'm Shandra Eldridge, your nurse consultant, back with another video, and today's video is a health and wellness video. And what's your daily dose? Well, your daily dose today is going to be surviving COVID-19. So we're going to talk about some tips and some tricks that you can do to help you survive this pandemic. And we are all going through it. It's all new for all of us. So much to decipher through, and so many different opinions and so many different thoughts and just a lot of different things out there. So I'm going to help you to just unplug, relax, bring down your anxiety and your fear, because it's normal to feel fearful and to have high anxiety of the uncertain. So there's a lot of things that people are uncertain of, so it's normal to have high anxiety and fear. So I'm just going to help you. Hopefully I can help you by sharing these tips to help you relax and to decrease your anxiety, and then empower you to do some things that will help you to stay safe and to stay healthy during the pandemic. So it's very easy when you are fearful and you're worried to just kind of forget about everything you know and kind of spiral down into this path of destruction. It's very easy to overeat. It's very easy to overdrink. It's very easy to be angry and take that anger out on the people that you love, like your kids, your spouse. It's very easy to feel like you're losing control. So in order not to do that, you want to focus on things that you can control. So what we do know so far is that the disease is very hard on people with pre-existing conditions. So if you are someone who has underlying health conditions like diabetes, cardiovascular disease like heart disease, if you have lung diseases like COPD, it's very easy for you to catch the disease, and it's going to be very hard for you to recover because your immune system is already compromised. If you really want to combat this disease, you really should focus on building up your immune system and becoming as healthy as possible. So the first thing that you can do is, number one, drink plenty of water. It's so important to drink your water. I know you hear this all the time, but you must stay hydrated and drink your water. The next thing you can do to boost your immune system is to take a vitamin C, D supplement, and zinc. Now, I do work in a hospital, and I have worked with COVID patients. I do work with them, and I know that some of the treatments they're using in conjunction with medication is vitamin C and zinc. Also, you can boost your immune system by eating clean, eating dark leafy green vegetables, adding more fresh fruit, also adding lean meats, and stay away from the processed foods. Processed food is just really not good for you for obvious reasons. If it's really fast, like you drive through and get it, it's probably not the best thing that you should be eating. And I know I can do a better job at that as well, because we're all on the go. We all have a million things to do, and it's just really so convenient. And some of it really is good, but it's not good for you. And it's good because it's got a lot of salt and a lot of just additives and different things in there that's just not good for your body. You want to stay away from those processed foods, because that actually weakens your immune system. And the next thing you want to do is wash your hands, wash your hands, wash your hands. Always wash your hands. And you want to make sure you wash your hands for 20 seconds vigorously, both sides. And you can sing the happy birthday song, get them real good in between, get those nails, and rinse your hands. Hand washing is so important. Of course you can wear your mask, and I just want to say one thing on the mask. I think that it's very important to wear the mask. However, the mask is not a substitute for staying at home. The best thing we can do to fight this disease and to bring down the number of people that are being infected is, number one, take care of ourselves, meaning our immune system. Then number two, staying at home, practicing social distancing. Practice those good hygiene practices. You also want to disinfect high traffic surface areas, you know, like your kitchen countertops, your door handles, your steering wheel in your car. You know, we want to continue all these practices. It's kind of like everybody was like driving it a couple of months ago, where here it is July and we're seeing this huge spike in cases in Texas. So we really want to remember the things that we're supposed to do and stick to those things. It takes about 60 to 90 days to change behavior. So it's just something we're going to have to get used to, and we should have already been washing our hands and wiping down and disinfecting high traffic areas already. But you know, it's never too late to start and really just practice these behaviors, because if we don't, we're going to continue to see a spike in cases and people are going to get sicker and sicker, and we don't want that. And you got to think about the elderly, the people with the underlying conditions, and then also the very young, because they're also starting to contract the virus. The virus is very new, so we still have to practice those things and make sure that we're doing our part to keep everyone safe. And so, you know, surviving this pandemic and finding happiness in this pandemic really is about doing the things that you can control. And like I said, you know, you can control what you put into your body. You can control how you build and strengthen your immune system. You can control washing your hands. You can control you wearing your mask and your proper PPE. If you have on a mask and the person doesn't have on a mask, at the end of the day, you had yours on, so you have some type of protection. If they don't, that's on them. That's their responsibility, and they got to deal with the consequences if there are any. So you can't be worried about what someone is doing, what they're not doing, because worry, stress, and anxiety also weakens the immune system. So just focus on the things that you can control, and that will take you a long way. Now, finding happiness during this pandemic and surviving COVID-19 is very, very doable. And I believe that it's all about your mindset. And if you have a strong mindset and you know that you're doing everything that you're supposed to do, then you're going to get through it, and you're going to get through it without having any issues, probably without even getting the virus. Like, I work in it, I'm in the thick of it. I don't even think about it. Like, it's actually becoming the norm for me now. And if I had that mindset, well, oh my God, I'm going to get it, I'm going to get sick, you know, I'm going to die, nobody's wearing their mask, blah, 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 I would be crazy, because I literally have to work with these patients. So as long as I put my PPE on and I'm taking care of my immune system, I'm de-stressing when I need to. If I feel anxious, I take a break. Like, I just feel like everything's going to be okay. So you got to have that strong mindset, you know, and focus on the good, focus on the positive, because that really does help your body. When you are positive and you have a positive mindset and you focus on the good and you're just in a good place and you're happy and you try to find solace in everything that you do, then it has a physiological response on your body. Like, your brain is very powerful. So if you're thinking these positive, happy thoughts, it does something chemically to your body, and it helps your body to relax. So therefore, you don't get as sick, and you're just more able to deal with things, and your immune system is not broken down, and your defense mechanisms are not, you know, always up, and you're like, rah, you know, about everything, and that causes stress. So I really believe it's important that you have that positive mindset. And speaking of having a physiological response, I think that when they talk about people being asymptomatic, In my opinion, I don't think there's anything as being asymptomatic, simply because to me it's like a pregnant woman saying, I didn't know I was pregnant.
You are having a baby.
It is a physiological response. Your body is very much alive, like it is a living cell. And so when you start to go through a metabolic change, even when you get sick, you know, your cells start to work in, white blood cells get to working, you know, it goes through this process and it's alive. So you're going to feel something. You're going to feel like, oh, maybe, you know, I'm a little tired. I feel real weak. Or you have this general malaise feeling. You kind of feel like, I don't really feel too good. And it may be something quick like that. It may be, you know, you may feel like you have more aches and pains. Your joints might hurt. Or you might have a little bit of a stiff neck. Or, you know, a little scratchy throat, but not much. And you may say, oh, you know, I have allergies. It's so many things that can kind of skew you away from actually believing that you may have something. So I think a lot of times we are self-deceived, can be in denial and say, oh, maybe I'm just getting a cold, or maybe, you know, I just got a little runny nose, or it's my allergies. But you know something is different. Just like when you're pregnant, your stomach grows. Like, yes, you may be gaining weight, but it's a different type of weight gain. Your baby is alive, it moves. You know, your body changes, your breast changes. There's a lot of metabolic and physical changes that go on to alert you. I mean, that's all part of God's plan. Like you are not alerted because you don't want to be. You're in self-denial about the whole thing. And like I said, your brain is very powerful. So if you keep telling yourself, this is not it, this is not it, this is not it, you're going to start to believe it. You'll believe your own lie. So this whole thing about asymptomatic, I don't really know, but you know, just like our old friend
for COVID-19, which blew me away.
Yeah, you had to have known that something was going on, because you know, he even said, oh, I felt tired, you know, dehydrated. Like, there are some signs. You just got to pay attention to them. Like, you got to pay attention to those signs, people. Yeah, so just be careful and pay attention to your body. Even like with chest pain, you know, and things like that, just pay attention to your body. And I also want to encourage you, if you are feeling sick for any reason, please seek medical attention. We do have the capacity to take care of patients. You got to not believe everything you see and everything you read. You have to do your research. You have to talk to people who actually work in the hospital. Reach out to your community leaders that you trust and get the right information, because it could save your life. Make sure you just get the right kind of education. Educate yourself. That's all I can tell you. Educate yourself and be open to the answers that you get. Sometimes what you're looking for may not be the answer that you get, but it may be the right answer. So just be open, and always seek out an expert and someone that you trust. That's really important. And secondly, exercise. Go for a walk. Even if you're not like vigorously exercising and walking and running and doing push-ups and stuff like that, if you just get out the house and go for a walk, get some fresh air. And I see some people walking with their mask on. If you want to do that, do that. But you know, even if you don't want to wear your mask and you go for a walk, get some fresh air. It's really imperative to your mental health. Get out of the house, go for a walk, and kind of decompress. If you can go with a friend, go with a friend. If you go with your spouse, and just talk about how y'all are feeling about everything. It's a great time to just walk and talk. Get out the house and do that. And the next thing you can do is get creative. Like for me, making these videos for you guys and doing my makeup, and just, you know, I've started to plant flowers and work in the yard, which I would have never done 10 years ago, 5 years ago, even 2 years ago. I had to cut my grass one time when I first moved in my house. And let me tell you, I only cut it one time and never again. And that, my friend, I'm probably not going to do again, because I was so exhausted and so hot. Every muscle in my body ached after that. So that's a job for someone else, not me. But I've been planting flowers and watering my grass and stuff, and it really has helped me to decompress. because my job is very stressful, and I do have to find ways to decompress and reconnect with why I fell in love with nursing. And that's a whole nother video. So if you guys want to know why I chose to be a nurse and why I fell in love with nursing and what nursing is all about, drop me a comment below and let me know. And then also, when you get creative, you can, you know, write a book, start a home improvement project. There's so many things that you can do to kind of take your mind off this whole COVID thing, but that's just a few. You know, you can actually make masks for people and donate them, or even sell them if you want. But use this time to do something that's special to you and that will make you feel good about being alive, and make you feel good about being yourself. And also, you can journal. Journaling is a great way to help you to deal with anxiety and stress. It's an outlet. You write how you feel, raw, honest emotions, and just chronicle that. And you can always go back and read it and reflect on it. And it's just a way to really get your feelings out and get them down, so you can go back and look at them and just reflect on them. And hopefully it'll bring about a change in how you feel, and just to help you to, you know, get out of whatever funk that you may be in because of this whole COVID thing. And then lastly, I just recommend talk to someone. It's okay to get a therapist. It's okay to seek out professional help. A lot of places, if you are employed, they have the Employee Assistance Program, EAP. Please reach out to these people. They are there for you. They're there to help you. Talk to a therapist, a grief counselor, and it was very, very beneficial for me. At first, I was a little like, I don't really need to talk to nobody, because you know, I'm cool. I'm gonna be all right. Me and my Lord, me and my God, we're gonna be good. But then I realized that it wasn't anything wrong with it, and I really just needed to talk, because sometimes I'd be at work and I just would be welling up with grief. And you know, you could just pick up the phone and call this person and they would listen to you. And sometimes you need to talk to someone else besides your family. So I would recommend, if you do have access to a therapist, use that. But if not, talk to your friends and family, someone again that you trust, someone that you're very close to, and just really talk about how you feel and be constructive in how you express your feelings. And I think that'll be a great way to release all of that, because I think a lot of times you just need a release. And then lastly, you know, take a bath. Put you some Epsom salt in there and relax. Do something relaxing like that. Take a nice hot long bath. Gentlemen, you can do it too. Put you some Epsom salt in there. Get you a glass of wine or your favorite beer and just relax. I like to get a hot steaming towel and put it over my face and just lay back in the bubbles and just let it all go. So anyway, guys, that is my story and I'm sticking to it. Those are my tips for you today. Finding happiness in this pandemic and surviving COVID-19 is very doable, and I hope you enjoyed these tips. I hope that you find them useful, and if you do, you like this video, give it a thumbs up. Show me some love in the comments. What do you think about some of the tips, or have you tried some of these tips already? If so, drop me a comment below and let me know. Let's talk about it. And don't forget to subscribe to my channel and hit that notification bell so that you will be notified when I upload more tips, more videos on tips, strategies, and tools to help you live your life and live it well. So on this channel, we stay lit, we learn, we invest, and we teach. And I always am up to share tools, tips, and strategies to help you live your life and live it well and let your true beauty radiate out. So again, thank you guys for watching, and stay tuned to Prescription Nurse. Now that's your daily dose.